Hello. Today we are going to learn about bursitis. Bursitis is an inflammation of a bursa, which is a sac filled with synovial fluid. Bursae are located near bony prominence and between bones, muscles and tendons. The fluid in bursa helps to reduce friction between moving tissues and facilitate smooth movement. When a bursa gets inflamed, it swells, develops friction and starts irritating the tendon it is supposed to protect. There are over 150 bursae in the human body and bursitis can affect any of them. Bursitis commonly occurs in shoulder, elbow, hip, knee and foot joints. The most common cause of bursitis is repetitive motion, such as frequently lifting objects or painting walls. Trauma, like falling on your knees or banging your elbow on a hard surface, could also cause bursitis. Another cause is prolonged pressure on the joints, such as kneeling for a long period of time. Muscle weakness could cause abnormal movement pattern, which contributes to bursitis. Sometimes, bursitis is caused by infection, which is called septic bursitis, or by autoimmune disease, such as rheumatoid arthritis. Signs of bursitis include dull pain at the affected area, which may worsen with movement, tenderness, swelling, and reduced range of motion. The affected area may also look red and feel warm to the touch. During medical assessment for bursitis, the doctor will take a thorough history of the patient, noting the patient's occupation, leisure activities, and whether there was a recent injury. X-ray will be taken to rule out fractures or arthritis. Ultrasound and MRI can be used to detect a swollen bursae. To detect infection, blood test or aspiration, which is taking a sample of fluid from a bursa, may be done. Treatment by the doctor would include prescribing pain medications to reduce pain and anti-inflammatory medication such as corticosteroid injection to reduce swelling. If the bursitis is caused by infection, antibiotics will be given. If the bursitis keeps coming back, it may need to be drained by aspiration or removed surgically. Physiotherapy assessment would include physical examination. During the examination, the physiotherapist will apply tests to locate the bursa that causes pain. Physiotherapy treatment includes rest, ice, compression, and elevation to reduce swelling. Alongside ice, other modalities of electrotherapy such as ultrasound and interferential therapy could also be used to decrease swelling. Massage could increase blood circulation to the affected area, which is beneficial for healing. Home exercises are great to restore patient strength and range of motion. The patient would also be advised to use proper padding during activities that could irritate the bursa. It is important to note that most bursitis can heal on their own with adequate rest. I hope you enjoy this video. Thank you for watching.